to vacate the quorum call.
Without objection.
Mr. President, what the Trump administration is doing to sabotage health care in our country is a monumental scandal in slow motion. What the president promised was better care for all Americans at lower cost. What he and his officials have delivered is special deals for special interests and rewards for ripoffs. They literally, it's almost as if you took the clock above the chamber and turned it back. What Americans want, and I heard it at town hall meetings last weekend at home in Oregon, Americans want to move forward on health care. They want, for example, to have strong measures, not empty rhetoric, to hold down the cost of their medicine, lifting the restrictions so that Medicare can bargain to hold down the cost of medicine, and using the smart principles of negotiating power that the private sector uses all the time. They want to move forward on health care, not backward. And there is no clearer example of the administration trying to take the country back on health care than its efforts to give a green light to junk health insurance. Junk health insurance represents all of the unsavory insurance industry tricks and abuses that the Affordable Care Act sought to eliminate. Junk plans exist, literally and figuratively, so that companies can prey on the vulnerable, the people with pre-existing conditions, like if you have asthma or diabetes, prey on women, prey on older people, prey on the less fortunate. They certainly don't exist to cover the health care that Americans actually need, because that's where they always fall short. Mr. President, the centerpiece of the Affordable Care Act was an ironclad, loophole-free guarantee that no American would ever face discrimination over a pre-existing condition. And I note my friend, the President of the Senate, has joined the chamber. He knows this pretty well because he worked with me on our bipartisan effort to ensure that there would be loophole-free, airtight protection for Americans from discrimination against those with a pre-existing condition. And for all practical purposes, we got what we worked on in a bipartisan way, where we had 8 Democrats and 8 Republicans. We got that into the Affordable Care Act. And essentially now, what the Trump administration seeks to do is undo that guarantee of airtight, loophole-free protection for people who have these pre-existing conditions. And I'm just going to read a question that appears on an application for one of these plans that is being marketed now. Under a bold headline that says, "Important," this junk insurance plan says you must answer the questions. Answer the questions below as they apply to you and all other family members applying for coverage. And that's a verbatim quote. The question reads, and I quote, "Within the past 5 years, have you or any other person to be insured been aware of, diagnosed, treated by a member of the medical profession, or taken medication for cancer or a tumor, stroke, heart disorder, heart attack, coronary bypass or stent, peripheral vascular disease, carotid artery disease, chronic obstructive pulmonary disease or emphysema, kidney disorder or disease other than kidney stones, liver disorder or disease, neurological disorder, degenerative disc disease or herniation or a bulge, rheumatoid arthritis, degenerative joint disease of the knee or hip, diabetes, Crohn's disease or ulcerative colitis, bipolar disorder or schizophrenia, any eating disorder or alcohol abuse or chemical dependency, or does anyone listed on the application currently weigh over 250 pounds if they're a woman or over 300 pounds if they're a man? Another question on the same application asks, have you or any other person to be insured been hospitalized for a mental health condition in the past 5 years or been treated by a member of the medical profession for a medical condition in the past 12 months? And finally, another question asks, have you or any other person to be insured ever been diagnosed or treated for acquired immune deficiency syndrome, AIDS, AIDS-related complex, or any other immune system disorder such as HIV? I'd also note that this part of the application contained a number of typos, a mislabeled number, a mislabeled word. Apparently, the scam artists are as bad at editing their documents as they are in covering the health care that people actually need. But setting aside the bad grammar, the questions collectively tick through. All of those questions that I just went through, they collectively tick through dozens of health categories that include hundreds and hundreds of various conditions and illnesses. So you're talking about well more than 100 million Americans who would answer yes to at least one of them. Americans need to know, they ought to know, the only reason junk insurance companies ask these questions about your health background is to use the information against you and keeping you from getting meaningful coverage. That forms the basis of the Trump-era discrimination against those with a pre-existing condition. Mr. President, a lot of people have pre-existing conditions. What's that? And everybody knows folks in Tennessee and Oregon who have asthma or diabetes. We're talking about millions and millions of Americans. And I thought, when my colleague from Tennessee and I were working together, 8 Dems, 8 Republicans, I said, you know, this is really going to be monumental if we get airtight, loophole-free protection for those with pre-existing conditions. And the reason I said that is ever since I was director of the senior citizens at home, the Great Panthers, it was clear to me that as long as our country allowed discrimination against those with pre-existing conditions, health care in America would basically be for the healthy and the wealthy. If you're healthy, no sweat, no pre-existing conditions. If you're wealthy, also no real problems because you just write out the checks to pay for your conditions. But now we're talking about going back to those days. Not the days when the senator from Tennessee and I and other Democrats and Republicans got together, did something that really was a monumental step forward, protecting millions of people with pre-existing conditions. But now we're going backward, and what are those Americans going to hear in their time of need when their cancer comes back or when they face another bout of medical illness? What they're going to hear with policies like the one that I just read from is the fraudsters who conned them into buying the junk insurance are basically going to say, you're on your own, and those Americans are going to be buried under mountains of medical debt. And by the way, when we're talking about medical debt, I think my friend from Tennessee and I talked about this over the years. Healthcare is the great equalizer. We had, for example, at a discussion Democrats ran yesterday on health care, we had a gentleman who did everything right. He worked hard, he was professional, constantly was trying to better himself and contribute, not just supporting his family, the community. Then he got Parkinson's. And all of a sudden, he wasn't able to pay his bills. So healthcare is the great equalizer in America. And when I read about the junk plans, I got to tell you, it takes me back to the old days when these scam artists preyed on the seniors who needed insurance coverage above and beyond what they got from traditional Medicare. Mr. President and colleagues, this is something that's very personal to me because I was a young man. I was co-director of the Oregon Gray Panthers. I'd go and visit a senior in their home, and very often they'd have a small apartment or something. They'd go in the back, and they'd pull out a shoebox full of Medigap policies. These were policies that insurance salesmen sold them that the salesman said would fill in the gaps in Medicare. And frequently, a senior would spend thousands of dollars, and this was a number of years ago, on these policies that were worth little more than the paper they were written on, and often contained, and we saw this at our legal aid program for seniors, they often contained what are called subrogation clauses, which essentially meant if you had another policy that covered it, well, the first one didn't have to cover. The two of them canceled each other out. And so vulnerable seniors with serious medical conditions would get conned into buying these plans that were essentially worthless. And after years of effort, we began in Oregon, the State Insurance Commission office. I had the honor of getting elected to represent Oregon in the United States House of Representatives. We began there. We've continued it in the Senate. We acted in a bipartisan fashion to eliminate the junk plans. And we did that literally decades ago. We drained the swamp. To use the lingo of today, we really drained the swamp as related to these rip-off Medigap policies. We got it down to a handful, and I'd be willing to bet that the senator from Tennessee, the senator from Ohio, and the other colleagues who are on the floor, they don't have folks at home coming up to them any longer and telling them that there's rip-off Medigap insurance. Haven't had a complaint about this for years and years. But now the Trump administration is trying to bring back junk insurance for an even larger portion of the American people, more people than just the seniors. And the bad news with these junk policies doesn't begin and end with discrimination and death. The Trump administration is letting the junk insurance companies steal the money Americans pay in premiums and other expenses. According to one recent study, half of each premium dollar, sometimes as much as 2/3, gets wasted on overhead, administrative costs, and profit. Again, the Affordable Care Act had a rule that banned that kind of waste. The Trump administration threw it out so that the rip-off artists can once again pocket unsuspecting Americans' premium dollars. And what the Trump administration is doing to undermine health care is not only playing out in what is called the individual insurance market. The harmful threat is a threat to the 167 million Americans who get their insurance through their jobs as well. Worse, health care costs at a higher cost, a far cry from those people were promised a few years ago, is clearly a growing problem. Worse health care, higher costs. A forced march back to the days when health care in America, as I've said, has really been my reference point. As much as anything, I've said, let's not turn back the clock to the days when health care was for the healthy and wealthy. And this junk insurance is unquestionably the kickoff of this administration's formal efforts to do just that. There was an effort in the Affordable Care Act to build a functional market that didn't trample all over typical Americans and their families. The President and his allies in Congress have done everything they can, starting with an executive order on day one, to empower the scam artists and powerful companies to have the ability to make health care worse and rip our people off. That's been the story from day one of this administration. It is, as I said a few minutes ago, Mr. President, a monumental scandal in slow motion, and on behalf of those Americans that are hurting, that are being taken care of, many of us are going to do everything we can to make sure for those who are getting hurt, who can't afford these kinds of practices, we are going to keep this front and center of the American people until we end this consumer scourge. Mr. President, I yield the floor.